8 tips to stop snoring. It's 1 a.m. and yet again you've been woken up by your frustrated, sleep deprived partner. However, this time, instead of telling you to roll over onto your side like she usually does, she grabs your pillow and demands that you sleep on the couch because she simply cannot stand to listen to another second of your loud, irritating snoring. As you make your way to the lounge room, you start to feel frustrated too. All you want to do is sleep peacefully in your own bed without upsetting her, but you can't, not unless you get rid of this pesky snoring habit once and for all. Hello, and welcome to MedTouch, the best place to find the right medical information. If you often find yourself waking up on the couch or to an elbow in the ribs by your bleary eyed, grumpy partner, then chances are you're one of the 2 billion people worldwide who suffer from habitual snoring. When you doze off and progress from a light sleep into a deep sleep, your breathing is typically silent. However, sometimes the muscles in your mouth and tongue become so relaxed that they cause soft tissues in your throat to partially block your airways. As you breathe in, air flows past these relaxed tissues, causing them to vibrate, which creates the harsh, repetitive sound that we all recognize as snoring. Snoring is usually harmless and nothing more than a nuisance to you and your partner when it happens occasionally. However, if you suffer from chronic snoring, this may be a sign of a more serious underlying health condition. If left untreated, chronic snoring can increase your risk of chronic sleep deprivation, high blood pressure, cardiovascular disease, and it can cause unwanted strain and tension in your relationships. Luckily, there are many natural, safe, and effective ways that you can turn down or even mute the sound of your snoring altogether. That's why in today's video, we're going to share 8 simple tips that you can use to stop snoring and finally achieve a peaceful night's rest. Tip number 1. Seek medical advice. If you're often told that you sound like you're sawing logs with a chainsaw while you sleep, then it might be time to talk to your doctor. Frequent loud snoring can sometimes be a sign of a more serious underlying health condition, such as obstructive sleep apnea, obesity, or chronic sleep deprivation. Other indicators that your snoring is more frequent or severe include feeling fatigued and sleepy during the day, having difficulty with memory or concentrating, waking up choking or gasping for air, or experiencing chest pain or high blood pressure. Your doctor will be able to conduct tests or a sleep study to determine the underlying cause of your snoring and work with you to create a treatment plan to help manage your symptoms. Tip number 2. Lose weight. You may have noticed that whenever you put on a few extra kilos, your partner is quick to complain about your snoring. This is because weight gain is one of the main culprits of snoring. When you sleep, excess fat tissue in certain areas of your body, such as your neck and throat, can obstruct your airways and restrict your breathing, resulting in loud, unwanted snoring. In more severe cases, it can also cause obstructive sleep apnea. Luckily, losing weight can help. In fact, research suggests that losing just a few kilos can significantly decrease and, in some cases, eliminate snoring altogether. If you'd like to learn some simple, effective, and realistic weight loss tips, be sure to watch our dedicated videos on how to lose weight and keep the weight off for good. You can find the link in the description box of this video. Be sure to check it out. Tip number 3. Avoid alcohol. After a long, hard day, it can be tempting to kick back and unwind with your favorite alcoholic beverage. However, when it's time to finally hit the hay and get some much-needed shut-eye, that tall glass of wine or ice-cold beer will only end up disrupting your sleep and making that pesky snoring habit even worse. This is because alcohol is a depressant, which means that it slows down the function of your central nervous system. As a result, it relaxes many of your muscles, including the muscles in your throat that assist with breathing. When these muscles become relaxed, your body has to compensate for a lack of oxygen by forcefully inhaling and exhaling air. This causes the soft tissue in your upper airway to vibrate, causing those characteristic annoying snoring sounds. Drinking alcohol also causes your mouth and throat to become dry due to dehydration, which further increases the sound and intensity of your snoring. Although alcohol can still be enjoyed in moderation, for the sake of you and your partner's ability to achieve a restful night's sleep, it's best to avoid it altogether. When you get the urge to drink, reach for sparkling water, non-alcoholic beer or wine, or fresh homemade fruit juice instead. It may also be helpful to find some alternative ways to de-stress after a long day at work, such as going for a walk, trying a new hobby, listening to music, or practicing yoga or meditation. Tip number 4. Practice sleep hygiene. When you snore, it's harder to get a restful sleep. However, when you don't get a restful night's sleep, your snoring only gets worse. To help overcome this, it's useful to set yourself up for a great night's sleep by practicing good sleep hygiene. Despite the name, this isn't about personal cleanliness, though showering and bathing does help. Rather, it's about preparing your mind and body for a restful night's sleep. Here are a few useful tips you can try. Go to bed and wake up at set times each day. Yes, even on the weekends when you are tempted to sleep in. Make sure your room is dark and try to reduce your exposure to blue light in the lead up to bedtime. Declutter your mind with a gentle activity like reading a book or meditating before bed. Avoid napping as much as possible or restrict your napping to no more than 10 minutes during the first half of the day. Lastly, keep your bedroom nice and cool and get rid of any loud noises or distractions. It's also important to take note of your sleeping position during the night. Sleeping on your back can make snoring worse by causing your tongue to fall into your throat and block your airways. To prevent this, try sleeping on your side instead. You may also want to invest in a good quality mattress and pillow to ensure that you stay comfortable and don't end up changing your sleeping position too much throughout the night. If you'd like to learn more helpful tips for improving your sleep hygiene, we have dedicated videos on our channel for you to watch. These can be found alongside our weight loss video in the description box of this video. Tip number 5. Stay hydrated. If you're a chronic snorer, chances are you've tried or you're willing to try just about anything to get a peaceful night's sleep. However, the cure to your snoring troubles may actually be way easier than you think. And the best part is, it's free, totally natural, and all around you. Yep, that's right, water. Staying hydrated and drinking enough water is a simple, natural way to help you snore less. This is because when you're dehydrated, mucus in your nose, mouth and throat become thicker, which causes your airways to become narrower, resulting in poor breathing while you sleep. Dehydration also causes a dry mouth and throat, which can further aggravate snoring and make it even louder and more irritating for your partner to listen to. To help with this, try keeping a glass of water next to your bed so you can take a sip or two when you feel thirsty or when your throat feels dry. During the day, keep yourself adequately hydrated by drinking at least 2 litres or approximately 8 glasses of water. Just make sure you don't drink too much water at night. You don't want to disturb your sleep by having to get up in the middle of the night to use the bathroom. Tip number 6. Stop smoking. Smoking paralyzes tiny hair-like membranes in your airways, which are responsible for removing germs and other allergens from your respiratory system. Without these membranes, harmful chemicals contained in cigarette smoke irritate and damage the lining of your nasal cavity and throat, causing swelling, inflammation, and congestion in your upper airway. When your upper airway becomes obstructed, your ability to breathe becomes restricted, resulting in unwanted snoring. So, if you've been thinking about quitting, now's the time to start. Quitting has many benefits. Not only will it help you stop snoring, but it will also improve your overall health, and as a bonus, improve your relationship with your sleep-deprived partner. Once you've made a promise to quit, reach out to your doctor. Your doctor can help you come up with a quit plan, including prescribing you with nicotine replacement therapy to help manage your cravings. You can also reach out to your local 24-hour quit helpline for more information or extra support with quick starting your smoke-free journey. Tip number 7. Avoid sedative medication before bed. Similar to alcohol, medications that make you sleepy, known as sedatives, suppress your brain and relax your tongue and the muscles in your throat, which obstruct your airways while you sleep, resulting in loud, irritating snoring. Have a chat with your doctor about any prescription medications you're taking that may be making your snoring worse. Or, if you have trouble sleeping, ask your doctor about a more natural sleeping aid that won't increase your risk of snoring, such as sleep hormone medications or supplements. Tip number 8. Consider medical treatment. If your snoring continues to persist, despite trying the tips in this video, don't lose hope. There are many alternative medical treatments that can help to reduce or eliminate your snoring once and for all. Here are a few examples of some treatment methods that your doctor may recommend. Dental devices or mouth guards. These help to prevent snoring by keeping your airways open by bringing your jaw and tongue forward during sleep. A continuous positive airway pressure machine. This machine helps to keep your airways open during sleep by blowing pressurized air into a mask that you wear over your nose. Palatal implants. This procedure involves insertion of small plastic implants into the soft palate of your mouth, which helps prevent it from collapsing and causing snoring. Lastly, surgery. Sometimes surgery may be required in order to increase the size of your airways or to remove tissues or abnormalities that may be obstructing your breathing and causing you to snore. Have a chat with your doctor to determine which treatment method will work best for you. So there you have it, 8 tips to stop snoring and finally achieve a peaceful night's rest. Thank you for watching. Be sure to like this video, subscribe, leave us a comment, and turn on that notification bell so we can stay in touch.